Hi, good evening. I'm Fami Berry. Welcome to another conversation with me. Today we want to talk about Q fever. Q fever is a bacterial infection caused by the bacteria Coxiella bonnetii. It mostly affects people who are around livestock like cattle, sheep, and goats. You can catch it by breathing in dust from contaminated animal waste, and it can also give like a flu-like illness, and in some cases more serious complications if not treated. A brief history. Q fever was identified in 1935 in Queensland, Australia, hence the Q for quarry fever because it was first initially unknown. Under signs and symptoms, we have the acute Q fever and we have the chronic Q fever. For acute Q fever, the signs and symptoms that it presents are high fever, severe headache, muscle aches, fatigue, chills and sweating, vomiting, chest pains, cough, hepatitis-like symptoms. For chronic Q fever, we talk about liver damage, we talk about ongoing fever and fatigue. We also talk about how it develops more with months and years later, especially in those with weak immune system. Under diagnosis, we talk about lab testing, and here we explore tests like serology testing and PCR testing, where liver enzymes are being monitored for elevated liver enzymes parameters, and also CRP may be seen. Other tests that can be explored are chest x-rays and echocardiogram, especially for chronic cases where the heart valve has been infected. Key findings are a positive serology testing for phase 2 antibodies, which is for acute, and for phase 1, which is for chronic, and also history of animal exposure. For physical examination, we talk about checking out for fever, signs of pneumonia, tenderness, heart murmurs in chronic cases. Often, the physical exam is non-specific and it resembles other febrile illnesses. For clinical presentation, we talk about how Q fever presents. It presents as a sudden flu-like illness with fever, headache, and fatigue. It can cause pneumonia, hepatitis in acute stages, and in chronic cases, it can cause serious heart, liver complications. For differential diagnosis, we talk about illnesses or infections that mimic Q fever. Here, we explore illnesses like influenza, viral hepatitis, brucellosis, typhoid fever, community-acquired pneumonia. The distinguishing factor here is history of livestock exposure, elevated liver enzymes, positive Q fever specific antibody. For causes and risk factors, we know that it is caused by the Coxiella bonnetii bacteria, and it is a highly infectious bacteria. For risk factors, we will explore cases of where you work with farm animals, you're living near farms, exposure to animal batting products or betting products, inhaling contaminated dust particles, exposure to animal farms. The bacteria are resistant and can survive for days in the environment, hence long periods of transmission. Under treatment, we explore the first line of treatment, which is doxycycline, 100 microgram 2 times daily for 14 days. But for chronic Q fevers, we explore long-term use of antibiotics. This is antibiotics combination of doxycycline and hydroxychloroquine for 12 to 18 months. We also explore supportive care, which includes rest, hydration, and managing the symptoms. For management, early diagnosis and prompt treatment is advised. Preventing further exposure is also advised. Also, monitoring of chronic complication is very much advised. For prognosis, we talk about acute Q fever. Most people with acute Q fever after treatment recovers within few weeks. But for chronic Q fever, it is more serious, especially in people with heart valve disease and weak immune system. It requires a long-term care, and management and proper treatment is advised and strictly adhered to. It's important to note that prevention is always better than cure. So in this case, staying away from contaminated animal or livestock waste is very much advised. Thank you so much for listening. I remain Fami Berry. See you in the next video.